As many of you might agree by now, we can say that aging begins at birth, but we normally identify aging with changes that come after a certain age. In gerontology, you'll often hear the term of normal aging, which refers to the changes aging individuals experience and are not necessarily harmful. Although older adults are usually depicted as sick, in our society, studies show that majority of 65 plus years old are healthy enough to engage in most activities of daily living and they can take care of themselves as any other young adult. However, the probability of experiencing limitation increases with age. You are also well aware about our national demographic changes, and you might have probably heard some debates or at least comments in relationship to our healthcare system. So the question is, when you grow old, who would you like to provide for you? Do you think families should provide for their own? Statistics show that American older adults have rich and extensive families. In 2011, 72% of men and 45% of women over 65 years old were married. Most of these families have adult children and grandchildren. In addition, many of these older Americans have siblings and they are in contact with. But advanced age frequently brings a need for caregiving. Activities of daily living such as dressing or preparing meals can become limited for some individuals due to chronic conditions, and the immediate one taking the role of caregiving is the spouse. But what if the older spouse has his or her own limitations? In fact, the big problem for old couples is that spouses are both impaired and looking for their older children adults taking the role of caregiving for them. The responsibility of caring among family members can be explained by the exchange theory of aging, which refers to the idea that interaction in social groups is based on reciprocity. This theory explains how family members and even friends will care for each other based on moral obligations or even the comfortable knowledge that you can count on your friends and family in times of hardship. It's more in the idea of, I got your back. But the overwhelming majority of care for older relatives is still provided by women, wives, daughters, and daughters-in-law, who must balance life demands along with caring for the aged ones. And from here, we have the term of sandwich generation, which describes the impact of such caregiving responsibilities on middle-aged women. Just think about a middle-aged woman who is taking care of her older parents along with taking care of her young children. In 2013, it has been identified that nearly half of adults in their 40s and 50s have a parent aged 65 or older and are either raising a young child or financially supporting a grown child. And about 1 in 7 middle-aged adults is providing financial support to both an aging parent and a child. And of course, these numbers are expected to increase in the next coming years. In cases of extreme frailty or dependence, family members may become so burdened that they are actually burnt out. Caregiving for your loved one is rewarding, but can also become overwhelming. Juggling with the many tasks life throws to you can easily drain one energetically. Each community now offers many tips on how to avoid and overcome the caregiving burnout through social support, community classes, and respite care services. Respite care means a time off from the caregiving role. Typically, it refers to a short-term stay at a senior community, usually assisted living or memory care community. Respite care is a great living option for an elderly or disabled person who needs some day-to-day supportive services but still desires social stimulation, engagement, and activities. This type of care can also sometimes refer to in-home caregiving services, used for only a short period of time. The common stereotype that older people are abandoned by their children is largely inaccurate. It is a myth that has been busted by many studies' results. In fact, nearly half of older adults report that they live or expect to live in proximity to their children. 3/4 of older adults talk on the phone at least weekly with their children, and more than 40% talk to them daily. However, patterns have changed over the past 50 years. The idea of sharing a household in an extended family, it's dropped off significantly. Living under the same roof all together with our extensive family where several generations coexist, it's a word we have lost meet. We idealized this picture of the golden age of pre-industrial society. In fact, our current trend is being within our own tribe where only parents and children live in the household. This is what we call nuclear family. We previously mentioned that families today typically remain in close and frequent contact. We have intimacy at a distance or caregiving at distance, and these are terms that reflect the common desire by older people to live independently and yet still remain close enough to have regular contact with their grown children. One reason for the change in living arrangement is that more people are living into advanced age and those require help with ADL. As an example, I am 1,000 miles apart of my mom. I call her 2-3 times a week. I assign a person to help her whenever she needs help, and I also help her financially. I keep in contact with the assigned person who look after my mom, and this is an example of caregiving at a distance. And it is possible in my case because my mother is still very independent health-wise. But when my mother will advance in age, I am sure different tasks such as preparing meals might require someone's help, and then I will probably offer different living arrangements my mom will consider. With older ages and advanced medical technologies, chronic illnesses are not a novelty, and for some chronic illnesses come long-term care. But due to the expensive cost of healthcare, long-term care remains largely a family responsibility in the United States. Spousal responsibility is deeply embedded in our culture as a matter of both ethics and law. If a spouse is unable to provide care, then other family members such as children or siblings take the responsibility, just as it has been explained through the exchange theory of aging. And then we have the filial responsibility, which refers to the expectation that family members will care for each other. It is an implicit cultural assumption that is often interpreted ambiguously in the context of law, custom, and ethics. Commonly taught in some cultures, sometimes to the extent of expecting adults to provide care for aging parents over their own children. In the United States, 28 states currently have laws making adult children responsible for their parents if their parents cannot afford to take care of themselves. While these laws are rarely enforced, there has been speculation that states might begin dusting them off as a way to save on governmental expenses, and in here I refer to Medicaid. Now that you have an idea about how family is embedded in taking care of their own, let me ask you, how can government best support the strong sense of responsibility many families have for their elders? Or how should government respond to the high cost of paying for the care of older adults who need help? Well, government created major programs that help families in taking care of their elders. I am sure you all heard about Medicare and Medicaid, but I am not sure how many of you know the difference between the two. So let me go over the programs and then we can see how they can help us with long-term care. So Medicare and Medicaid are two different government-run programs that were created in 1965 in response to the inability of older and low-income Americans to buy private health insurance. They were part of President Johnson's Great Society vision of a general social commitment to meeting individual healthcare needs. Medicaid and Medicare are social insurance programs that allow the financial burdens of illness to be shared among healthy and sick individuals and affluent and low-income families. But please note, Medicaid is not the same as Medicare. No, and obviously Medicare is not the same as Medicaid. Medicare is a federal program that provides health coverage if you are 65 or older. If you are younger, you must have a severe disability such as end-stage renal disease, which is permanent kidney failure requiring dialysis or a transplant in order for you to qualify in receiving Medicare. So Medicare, it's a program that doesn't care about your income. It cares more about your health state and also your age. And then you have Medicaid, which is a state and federal program that provides health coverage if you have a very low income. So it has income restrictions. Medicaid doesn't care about your age, but it cares about how less money you make. So in California, I'm sure you have heard about Medi-Cal, which is quite similar to Medicaid. So if you are eligible for both Medicare and Medicare, it means you are dual eligible and you can have them both. Medicare and Medicaid will work nicely together to provide you with very good health coverage. Okay. So in terms of long-term care, you can say that Medicare provides near universal coverage for acute disease among the old, but in fact pays for only 2% of nursing home costs. So for whatever Medicare doesn't pay, it compensates Medicaid. And with Medicaid, it's actually shown that they pay for about 36% of nursing home costs. And you can only imagine in this way, Medicaid has become a key factor in nursing home coverage for middle-class older adults. So the cost of nursing home care continues to increase each year. In 2012, for example, the average cost of a year in a private room in a nursing home was over $90,000, and as it has been said, continues to increase. You can only expect that not that many can afford to pay such cost. So for those who cannot afford to pay the price in living in a nursing home, Medicaid is the one that will pay for the cost. Medicaid determines eligibility based on income and assets, and that's why many will look for loopholes in taking advantage of this program. Okay, so Medicaid is the fastest growing component of state budgets and has become the public program of last resort to pay for nursing homes. You might think that your loved one can rather stay home than in a nursing home. Moreover, when studies shows that people are aging better staying in their own residency rather than being assigned for nursing homes. And although this is true, in terms of long-term costs, studies have shown that while government-funded home care may be more desirable, it doesn't necessarily save money. And here it's reminded about the woodwork effect, in which government policymakers are afraid of people coming out of the woodwork demanding services that families have been providing but in reality not offered. As individuals and families have become more aware of the cost of long-term care, some middle-class families have found ways of qualifying for Medicare. Remember, didn't I tell you about loopholes? So Medicaid spend down is actually people impoverish themselves by spending all income and assets to qualify for Medicaid coverage. You also have divestment planning, in which people appear to be poor, and this way they will take advantage of legal loopholes to avoid the Medicaid trap. So it's actually unknown how many families do this, but obviously there are enough people to sustain a rapidly growing body of elder law attorneys. So toward the end of our chapter, you will have different readings. And in reading number 21, you have Medicaid explained, and also the steps that you will have to complete in order to qualify or to apply for Medicaid. In here also you will see the discussion of how Medicaid support or doesn't the financing of long-term care. Then to the next reading, you will have Jane Bryant Quinn, which critiques older people that deliberately transfer assets to qualify for Medicaid, and she considers this being a middle-class welfare. Do you think this charge is a fair one? The next reading, you have the author suggesting that there is a missing piece in the long-term care financing puzzle. So what do you think this missing piece is? What alternative way of thinking about the issue is the author proposing? Next reading, you will have the author saying that paid family caregiving can be the best but also the worst. So she suggests that paying family to provide elder care can contribute to the worst of care. So what are the counters of Blazer's argument? Do you agree or disagree? And the last reading of our chapter is saying that payments change the caregiver-care recipient relationship. Are these changes necessarily negative? I think in here you might discuss more pros and cons on the topic, and of course these discussions will usually emphasize the need of your own ideals about health-term cares and how or who should provide for the long-term care in the golden years. That's pretty much about this chapter. Have a great day. Bye.